Welcome back to physiology, and this time we're going to discuss clinical physiology. Last semester we discussed a lot about the basic physiology. Specifically, we discussed about the fundamental concepts in endocrine physiology as well as fundamental concepts in respiratory physiology. This time or this semester we are going to discuss about clinical respiratory physiology as well as clinical endocrine physiology. So, as for any physiological system, one thing that you need to know is to revise your anatomy. So, with the respiratory system also, you need to revise your anatomy. There's a lot of things that you need to revise or you need to understand when we talk about the anatomy, but I'm just going to mention some of the key things that you definitely need to understand. You need to go back and read before we start discussing the clinical concepts. Obviously, if you look at this, you have the tracheobronchial tree, and you do have the lungs here, and you have the diaphragm as accessory muscle of respiration. You need to understand all these structures, obviously, because they have a direct relationship to the clinical symptoms or clinical concepts that we are going to discuss. But of particular importance, you need to be able to distinguish clearly between the upper respiratory tract and the lower respiratory tract. This is important because obviously you are going to deal with either upper respiratory tract infection or lower respiratory tract infection, and you need to be able to distinguish the symptoms, the signs, different presentation of upper respiratory tract infection from lower respiratory tract infection. So what you need to know, you need to make a clear distinction between where does the upper respiratory tract end and where does the lower respiratory tract start. This will help you a lot to be able to tell the symptoms of upper respiratory or lower respiratory tract infection. But of course, another important thing when it comes to anatomy, which you need to revise and you need to understand, is the division of the respiratory tract. We know that we can divide the respiratory tract into two main divisions, and we have what is known as the conducting system, and this is where you don't have gaseous exchange, right? Depending on the characteristics or the structures that make up the conducting system. So you need to be able to know the clear distinction between the conducting system. Where does the conducting system start and where does it end? And of course, we do have the gaseous exchange region or the gaseous exchange part of the respiratory tract. And this is where gaseous exchange can happen. This is where oxygen can actually get into the blood. Carbon dioxide can also get from the blood into the lungs. This is where you have the function of the lungs, and basically you have the respiratory bronchioles, you have the alveolar sac, and you do have the alveoli. So this is actually where the real function of the respiratory system can actually start, because you have gaseous exchange. Of course, the conducting system is also important because oxygen need to come all the way down and carbon dioxide need to go out. So everything is important. But what I'm trying to say is make sure that you revise and understand these important anatomical structure that have a lot of relationship with the function, and at the end of the day they can help a lot to tell clinical symptoms, clinical classifications, and a lot of things related to diseases. So if you take a look at this diagram here, what you can see is what we call the chest, and within the chest you do have the lungs. So the lungs are actually confined within the chest, but what we need for the lungs is expansion. The lungs need to expand. Why should the lungs expand? The lungs should expand because oxygen is coming in, so the volume of oxygen that comes into the lungs needs space. So it needs the lungs to expand to be able to accommodate the oxygen. But also the lungs relax, and you have what is called elastic recoil, because carbon dioxide needs to be expelled outside. That means the volume of the lungs has to change to be able to expel out carbon dioxide. So with this, you definitely need to go back to what we call lung mechanics. Make sure you understand very well lung mechanics, because with lung mechanics, you will be able to tell a lot about clinical symptoms, clinical signs, classification of diseases, presentation of different diseases, and so many other things. So you need to understand them quite clearly, and you need to be able to relate them to the clinical concepts that we are going to discuss. So go back and read about the breathing and lung mechanics. It's very important.